Today I want to talk to you about the Facetite necktie MyEllevate procedure. Now, we have been flooding the socials with images of some of our before and afters of people that have had this procedure done. So naturally, lots of people have questions on it because the results have been honestly phenomenal. So what does the procedure involve, and what's the sort of likely downtime, etc. with it are usually the most common questions that people have. So we start off with the Facetite procedure and then follow on to the necktie procedure. Now that is a radio frequency treatment. It involves having a small probe which is placed just underneath the skin. This is all done under local anaesthetic, and the probe goes underneath the skin and we can apply radio frequency energy directly into the fatty tissue underneath the skin. Now that can tighten some of the fatty tissue, and in some areas it can destroy some of the fatty tissue, and sometimes that's what we want, sometimes that's not what we want. So in the neck and under this area, if you've got a lot of fatty tissue that is resistant to other treatments, then we do want to destroy some of that fat. In the face, less so, we'd rather tighten that fat, and we can change the amount of energy that we deliver accordingly. Okay. After that's done, we would then remove some of the surplus fat in areas that we don't want it using some gentle liposuction. And then we apply this suture, okay? It's called the MyEllevate suture. Now this suture acts as a hammock to the lower jaw and the neck area. It's a permanent suture, so completely different from threads. You've probably heard me talking about threads before. Threads are dissolvable sutures that last approximately 3 to 4 months before they will naturally absorb within the body's tissues. This suture that we're talking about, MyEllevate, is permanent, okay, so this won't go away, this suture. And it's just a smooth thread that runs underneath the jawline here, and it anchors away at the back of the ear here where you don't see it, and it gets pulled tighter and left under here. We pull this thread nice and tightly, it gets hidden, there is no scar tissue whatsoever. All the little portholes close up, leaving no scars, and we get this phenomenal lift. What it will do is it will lift the muscle tissues under here. Now that's called the platysma. So when we see little bands down here, people often call it turkey neck, people relate this all to being skin. Now, there might be a degree of skin laxity there, but mostly what we're seeing is platysmal muscle, and it's that muscle that's creating a lot of the problems. If we can anchor up that tissue, then you'll find that the neck looks much smoother and more lifted. And it will also help lift the lower jaw, because when we anchor over here, you can see that there is a tightening over the jawline. Brilliant treatment. The results are phenomenal, but there is a bit of downtime. You will expect some swelling and you will expect some bruising, and you have to wear a neck brace, which is a kind of soft neck support, and a compression bandage shortly after the procedure. Brilliant results. I highly recommend it because necks are difficult to treat.